Hi, I'm Brad Power, and I'm the host of the Linnea Olson Hackathon. And this is our fourth weekly update. And we have Linnea in person because her scan isn't happening today. She was going to be broadcasting live from Mass General, but no, she's at home. And we have a good turnout. We'll follow the usual format today, which is about a 15-minute lightning update. Linnea will update us on some of the things she's been working on and progress there. We'll have a few maybe quick updates from some of the folks that have been doing some of the data gathering and data hosting. And then we'll sort of close the formal session, stop the recording, and go to a kind of an open roundtable discussion for those who want to stay on. It's optional, but we've had some nice conversations, and we'll go for about a half hour after that. So without further ado, Linnea, what's the news?
Well, I've been busy just trying to assemble records and data, and Citizen has been great. My medical records at MGH were almost 5,000 pages, which is what I anticipated. So they now have that, and I FedExed my radiology CDs to them earlier in the week, so they should have those. And we had discussed the BAM files. Our Foundation Medicine released those too, but right now they just don't have the hosting capacity to put those up. So I have to figure out another solution for that. And in the meantime, I've gotten some results back from Foundation and Lucents, and there's nothing actionable, but there are some mutations of unknown significance. So it's going to be interesting to dial down on those. And then the only other thing to report is I will have a scan in 2 weeks, and I'm already in discussion with my oncologist about the possibility of getting a tissue biopsy, because I don't want to waste this opportunity. So essentially that will come down to whether or not the scan suggests that a biopsy is possible right now.
Great. And for those of you who recall, we're starting to build a queue of possible uses of such tissue if it were to be available, because there are a number of testing companies that have stepped forward and said that they would be happy to run tests on tissue if tissue were available. Just a couple things then on Foundation Medicine. David Marshak is on. David, is there any precedent for if we don't copy the Foundation Medicine BAM file, is there a way for Linnea to permission it just wherever you have it on your servers?
So there are two files. One is .bam and the other is .bai, and I was able to share that directly with Linnea. So if Linnea authorizes it, I think she could share that link. The one thing is we need to give permission to someone accessing it from a specific email address. So I don't think it could be made generally available to everyone, but if she authorizes someone else as a designee, we could add that as an authorized email address.
Yeah, that's the way we did it with Bryce, is that it was sort of selective authorization and consent. So they just went to Bryce and then permissioned that way, or I could. Because not everybody wants to see a raw sequencing data. So, whereas a pathology report, which TJ Sharp had mentioned in the chat, the PDF file is in the Slack now, and so we could also email it as an attachment if you'd like to everyone. But anyway, so if you want to see the detail, that is in the Slack. And we've got several people from Lucents here. We've got Jack and Minhan or Han Tan and Jeffrey Dunklin. Any update on the Lucence report? When will the liquid biopsy, or when will your liquid biopsy of Linnea's blood be ready?
So I believe this was actually sent out a couple of weeks ago. So the result was we identified a pathogenic mutation at very low frequency. This was in the TP53 gene, and yeah, we are happy to discuss more about this. It is not directly druggable, but it certainly does give a sense of what the of a signal at 0.22% variant allele frequency. This is expected as part of the fact that the low signal observed is consistent with our past experience in lung cancer diagnostics, and the correlation with the scan tumor load will be insightful. We do see a correlation between VAF, variant allele frequency, as well as disease load.
I'm sorry, did you say it was TP53?
That's correct. Yeah, let me get the exact.
Are there others?
No, I mean, we did not observe within our panel of the lung cancer specific genes any other pathogen, likely pathogenic mutations. This was a frame shift mutation, so it is nonsense.
And how many genes are in your panel?
We do 80 genes, and these are on an amplicon-based sequencing platform. So this is the amplicon-based sequencing platforms that we deliver claim a VAF of 0.1%. So what happens? Our coverage. I mean, this goes into perhaps some of the technical details of an amplicon-based platform as versus a more typical capture-based sequencing approach.
And
Do you know how your panel overlaps with Foundation?
yeah, that's what
I believe the Foundation, I mean, both in a way have helpful complementation in the sense that ours is an amplicon-based platform which is very focused, very that drills down deep into these 80 genes, many of which are actionable. And I think Foundation has a much larger 300 plus panel on using capture-based sequencing. And I'm definitely also very glad to hear from the Foundation team about their liquid biopsy panel.
Yeah, the reason I'm asking is the gene list overlap, just as basic as that. So for example, there were VUSs that were discovered in the Foundation report. So I was curious if those genes also happen to be in the 80 gene panel that you have or not.
Okay, I believe those, I believe those genes on the VUSs found do not overlap with our panel. Yeah.
Okay, okay.
Yeah.
Some
That's
of them
great.
may be interesting to explore in conjunction with the P53 variant that you found.
Great. So Ali is speaking from CureMatch, if you'll see her Zoom background. So that's
There.
her specialty is taking those sequencing results and doing some interpretations. So that's really great. There's been a lot of discussion on the Slack about some possible treatment options, which is another expanding area, which is pretty cool. Kimmery, you threw out like 2 or 3. Could you just kind of update on some of the ones that you've been finding?
well, I threw out probably something unconventional, but it's something that I've been just for other purposes been doing a lot of reading about just the metabolic inhibition of tumor growth. So metformin is a drug that I thought you might want to discuss perhaps with your oncologist as a try. And I mean, less with less anecdotal evidence. I also mentioned hydroxychloroquine as it's something that basically would kick in kind of the would inhibit the what's called autophagy, which is a process that cells use to recycle their own contents in a time of oxidative stress. So basically kind of starving the tumor of sugar and, glucose glutaminase oxidation pathway mechanisms of escape. And then I started looking at the variants of unknown significance last night as soon as I got the report, and just trying to, for my own understanding, to understand what these genes are, because I had only heard of a couple of them. And so it seems like, what sort of struck me is that some of them have been known to be found in germline mutations or in cases of familial lung cancer. And it made me beg the question whether or not there's any evidence of that in your family history.
Yeah, my parents both had cancer, but my dad had pancreatic and melanoma, and my mother had kidney and breast.
Mm-hmm. Okay.
Let me just go around the horn for a couple more quick things before in the kind of recorded session, and then we can open things up a bit more. Emily.
Can I add one thing, Brad, really quick?
Sure.
I think Kimmery had noted one of the VUS MCL1, and my colleague, Dr. Joanne Murphy, said another one that might want to be noted is called DNMT3A, because it's associated with clonal hematopoiesis. I don't have any more information than that, but I just wanted to share that too.
Thanks, David.
Yeah, that
Emily,
one could be actionable. I agree.
Okay. Emily, you posted something about ALK and some of the clinicaltrials.gov research that has been done.
Yes, so I just realized I posted it in the wrong place. So I just moved it to the Linnea Hackathon channel on Slack. And I posted an Excel spreadsheet that one of the other ALK positive group members compiles and updates every month. And that includes clinical trials for ALK positive lung cancer, and then also some more non-ALK specific lung cancer trials that are recruiting right now that our members might want to consider. So I thought it would be interesting for everyone to look at that. It's not really an exhaustive list. I think for ALK it's pretty exhaustive, but for general lung cancer or general non-small cell lung cancer, it's not. But there are a lot of different trials there. Of course, some of them are, in China and wouldn't be relevant, but I thought it would be interesting to go through.
And in a similar vein, I also posted something from Ellie Van Allen at the Broad Institute and Count Me In. That's a almanac they have. So it's choose your mutation, and then here are the FDA approved therapies, and here are the clinical trials. So it's a similar thing that they're doing with a broader scope. It's kind of algorithmic, I guess, and it's sort of another interesting resource which you can check out there if you're interested. Sophia, any update? Sorry to catch you off guard there. Any update on Citizen? You did a lot of work to get Linnea's files hosted.
Yeah, so we have, as Linnea mentioned, over 5,000 pages of medical documents. Her scans and DICOMs that are all viewable on the platform should be available by the end of today. And so once that is totally updated, Linnea will have the ability to share that with anyone, everyone. We can work through kind of how to make that easy because there's so many of us. The thing I was dropping into the chat regarding the overlay of the various liquid biopsy results is part of what our clinical team will do next week, is take all of her medical records and create what we call the cancer summary, which will be a clinical timeline of your care to date, including all of the liquid biopsy results overlaid on one another. Everything has source data verification. So, you basically click on an entity and the document that entity comes from pops up immediately. And so all of you will be able to navigate those 5,000 pages, hopefully much more seamlessly, because we realize that's a lot of pages and part of where our technology helps make them useful. And so we'll want to make sure, Linnea, that all liquid biopsy results you've had are in your profile. And so whether you have a copy of them or people can email them, I would say let's just do this on email with Mikkel and I, and we'll get those added to your profile immediately, just so that everyone can get access to that. Someone mentioned the BAM files earlier. It's something we are hoping to do in the future. Just right now, our engineering team is maxed, and as much as they wanted to, they just wouldn't be able to fit it in for a few months. And so we're happy to help with the acquisition of BAM files. It falls under patient HIPAA right of access. And so you can get those raw files. It sounds like Foundation has already shared them, but anyone who has sequenced you. And so if you need help getting those, we can certainly deploy our records team to help.
Great.
Thank you, Sophia.
Thank you.
Grace, you've been working a lot on Linnea's behalf. Can you kind of give us an update on, or any other comments you want to make?
Sure. So going back to my chat function here, I'm just curious, is there a way from a strategic standpoint and in planning, the results from there, is there a way to succinctly depict them on a slide or a series of slides as a reference document to show, because all of these tests are going to fill different gaps and unmet needs. There may be overlaps between different markers. Is there a way to actually image the pathways from a metabolic standpoint on a slide? That would be my whim ask. And to be mindful of time, I'll quickly summarize the SomaLogic conversations. So SomaLogic is a proteomics focused company, and oncology is not their primary goal at the moment. However, they're willing on a compassionate use one-off to run a sample for Linnea. So they are able to, they're estimating, measure about 7,000 plasma proteins from a 0.5 milliliter of a plasma sample. It would require a blood sample to be spun down for about 2 to 4 hours, and then about 0.5 ml of the plasma to be frozen and shipped on dry ice to their lab in Boulder, Colorado. There are 2 limitations, which is why I wanted to ask the group today. Again, they're not experts in cancer biology or in therapeutic target matching. So any ranked list of proteins that come up that are most deviant, whether they're upregulated or downregulated, would really need to be looked at from the expertise of other participants in this hackathon or colleagues that you all may know that are experts, in order to reach any actionable conclusions if there may be therapeutic options or pathways to pursue. So Linnea, I can connect with you offline and help with any of the just basic business operations and IRB approval protocols or anything that's needed to get that plasma sample processed if you're interested in going in this route. But the big ask would be is who could help with the biologic interpretation and pathway analysis if she did go this route?
I can.
Yeah, and I think there's some pathologists. I see John Spinoza and Devin Sned, and we've got a couple other pathologists in this community. So between them and Linnea is also going to be, we're going to be building out, I think, some more research oncologists to the team. We need to bring them on stream, and they could help. So I'm sure the crowd is good. So if we put out an all hands bulletin, I think with a specific request, Grace, like the one you're describing, we can get a sub team, even a mini hackathon around that.
Great. I put my email in the chat. The people who I apologize, I didn't catch everyone's name. If you could kindly reach out to me just so I know who you are, I'd love to just quickly get to know you, and then we can move on from there. So we have a plan in place if Linnea is ready to execute.
Well, I'll just pick up on that. Glenn Sabin is also on here. At one point he said, who's on the hackathon, and can we get their names and addresses and affiliations? And I've been trying to do that a little bit through the Slack, asking people if they're comfortable being identified in that way. And that's also the function of this next half hour where we sort of just have a roundtable where you get to know people and kind of where they're coming from in their institutions. Glenn, do you want to say anything before and this will be the last thing before I wrap up the formal section. Glenn? Oh, there you are.
Yeah, I don't have anything specific to add, although it would just be good to gather everybody's information, as you mentioned, and so that we can all have a document
right
to refer to.
Yeah.
So maybe we should just ask if there's anyone who would prefer not to be included in that way on a list.
Great. Yeah, good. And what Glenn's pointing at is something that I've felt and why we're having the roundtable section next, which is that part of it, this is like a conference when we don't have conferences, you know, so it's kind of the meet and greets that you would have informally at the side of a conference. And these are it's a very diverse group of people. I'm looking at all the people around here today, and it's just cool to meet and get to know those people and maybe find ways to collaborate, because we're all on a similar kind of mission. So thanks for that, Glenn.
Sure.
Okay, so with that, I'll end the recording. And